Hello, my name is Dr. Shane Watt. I'm the treating chiropractic physician at Metabolic Health Center. Today, we're going to discuss functional health for the treatment of peripheral neuropathy. Now, I want to tell you, the reason I got into this is, unfortunately for me, I have a lot of family history of peripheral neuropathy. Many of my uncles, many of my siblings are dealing with this. In fact, my dad, just a few months ago, got half his foot cut off because of peripheral neuropathy. And it eventually is going to be the cause of his death. About a year ago, I decided that I didn't like what was going on with my dad. I deal with a lot of other issues. One of the biggest things I deal with is thyroid and metabolic issues. But no one was really having success with peripheral neuropathy. I just didn't jump into that game because no one was having success with it. But because of what was happening with my family, I was seeing my uncles, I was seeing my dad suffering, I knew I had to find a way or find some answers. Now, luckily for you, I found those answers. There are answers to getting well with peripheral neuropathy. If you're tired of being told that there's no answers for peripheral neuropathy, if you want help, if you want to get well, there are things that can be done. But it's not a magic pill. It's going to take some work on your part. But your life can be changed because of what we do. This is just an intro version of our peripheral neuropathy video. There's a much longer version. But I want to get the highlights with you with what we talk about today. If that pricks your interest, please follow up and watch the longer version because it will be more in depth. We also offer seminars regularly at my office. We want to help you because nobody else is. We're going to explain why. Like I said, if you're tired of being told there's no answers, if you're tired of just taking medications, if you just see your symptoms getting worse and worse with no hope, we can help you. We're going to discuss what is peripheral neuropathy, what causes it, what can be done to restore it. Those are all things that we do in our seminar. Some of the symptoms and signs: numbness, burning, cramping, sharp electric pain, pain when walking, difficulty sleeping, tingling, prickling feelings, loss of balance, weakness, swelling. Now, some of you might have every one of those. You're going to be probably a harder case. Some of you might only have a few of those. But this will continue on to only get worse if you don't do something about it. The problem is no one looks at it in a different realm. The medical model gives you a medication, and that's about all they're doing for it. And to be honest, most of those medications were not even studied for peripheral neuropathy. Ask your doctor when he prescribes something to you. Neurontin was not helped for peripheral neuropathy. It was actually started as an anti-seizure medication. Okay, go figure. Think about it. You're getting medications that were not actually studied for peripheral neuropathy. There's different types of nerves: sensation, or sensory, motor, autonomic. If you're not working with those properly, you're not going to change those. Okay? Now, one of the things that people never, in the medical model, or in the healthcare that you're getting right now, nobody looks at metabolism. Well, you got to think about something. Your energy for your body comes via the food you eat. 30% of that energy goes to your nervous system. Think about how much your nervous system is in comparison to the mass of your body. It's probably about 10%. Your brain, nerves. Spinal cord, peripheral nerves. It's about 5%. Yet it consumes over 30% of the energy that your body uses. So if it's almost 1/3 and you're having a bad metabolism, how's that going to affect you? If you're having pain in the feet, if you're having issues in your feet, I can guarantee you're having issues in your brain. You are. There's no way you're not. You've got to pay attention to that. It's just not just a peripheral neuropathy problem. This is a health issue. Other things that cause it are statin drugs, damage to the back. Okay, that can affect those nerve roots. Arthritis, spinal stenosis, bulging discs, diabetes, insulin resistance. All those things play a part. Well, guess what? We can help with those because of our approach and what a different approach it is. We need proper metabolism, and that's the energy for a well-functioning brain and nerve. If you don't deal with the metabolic problems, that's what leads to peripheral neuropathy. And if you have peripheral neuropathy, if you don't affect the metabolism, you're never going to get well. Metabolic causes need to be addressed. You are to win the battle, if you are to win the battle against peripheral neuropathy. Okay? If you want to win this thing, you have to address metabolism, and nobody else is. We do proper testing, we do additional things for the metabolism, we do some dietary changes, things of that nature, because we got to get your energy. There's two things that you need. You need fuel and activation for your cells. You need proper glucose and proper oxygen, and we do both of those. We change your function. I have a patient right now that his blood sugars have decreased over 200 points since he's been in our program. That's huge. That is a life changer for that guy. We also do activation. You got to do activation. Otherwise, if you don't get proper stimulation, you're not going to get a regeneration of nerve tissue. The big bad boy that we do that nobody else has is what is called the HACOMED. Now, this does two cool things. You've probably already had people put electrical devices on your feet, and maybe you've had a little bit of success, but not much. The reason is because they're only stimulating it electrically. You've got to have chemical stimulation. The HACOMED is the only instrument that does bioelectrical effects as well as biochemical effects. Comes out of Germany. It's not an inexpensive machine. The HACOMED does what is called horizontal therapy. Okay? Now that doesn't really mean anything to you, but know that it does two drastically different things. And if you don't do both of those things, you're only going to get partial success. You've probably done some things that have had minimal success. But who's about minimums? We want maximums. You've got to do multiple things in order to get maximum success. It takes many different things to help peripheral neuropathy, not just one. You must address both the metabolic issues, the neurological issues. This condition is progressive, as you probably already know. If you do not do something now, it will only get worse. It's not one of those things that will just go away on its own. It will get worse. Our peripheral neuropathy program is the most comprehensive, state-of-the-art program in Utah, and probably some of the surrounding states as well. There have been many people that have had success in the program that I do. I've been mentored by doctors. I've got the program I use, I didn't come up with it. I researched it. I went all over the country dealing with doctors that were having success, and so I found out what they were doing. I made it my own, but I found pieces of many different things that were being successful. I have traveled all over the United States trying to get answers, and we do have answers. Now, once again, my name is Dr. Shane Watt. My office is Metabolic Health Center. You can call my office, 801-495-4444, to find out when our next seminar is. Or if you just want to come in on your own, we can do that as well. But I want you to know there are answers. Don't let yourself progress so far that it deteriorates your health and you have to have things cut off, like my dad did. Don't let that happen to you. Take the time to get your health back. It will take some time. It will take effort on your part. But if you don't do it now, it will only get worse. And if it gets too bad, there is a point of no return. Don't let that happen to you. Thank you so much for your time. Have yourself a wonderful day. Please give my office a call so that we can get you scheduled for either an appointment or come to the seminar. Thanks.